All right. Just a little bit about me. As he said, I am a principal consultant with Arcweb Technologies. I'm a certified project management professional and Agile Scrum Master with 20 years of experience as a management consultant on a variety of projects. I spent almost a decade working in the Federal Department of Health and Human Services, from business process engineering projects to large enterprise-scale software implementations. And that screen makes me look very, very tan. Just a little bit about Arcweb, which is based in Old City, Philadelphia. There I lead small cross-functional strategy, design, and development teams that help healthcare and technology clients solve their most pressing business problems. I've seen a great number of things that have worked and an even greater number of things that haven't. And so today, I'm here today to share with you a strategy framework for innovating in the digital health space. Let's start by framing the problem a little bit. Healthcare innovation is a huge challenge, but we see problems with innovation and that challenge across all industries. There was a survey done in 2018 by the company Couchbase that asked CIOs whether digital innovation projects in their portfolio had succeeded or failed based on their internal metrics. Across all industries, 80% reported that their projects had yielded no results. In 2017, the American Hospital Association asked healthcare leaders how they measured the success of digital projects. More than half responded that they had no real standardized system of evaluating whether a digital innovation project had succeeded or failed. So if 4 in 5 innovation projects can be expected to fail, and more than half of hospitals aren't effectively measuring whether a project succeeds or fails, is it any wonder that we have an incredible challenge on our hands innovating in the digital health space? Let's also quickly consider how we define innovation. The morning CIO panel was asked that very question: what does innovation mean to you? Because the buzzword is so common now and commonplace, it's not always clear that we're talking about the same thing when we use it. On one end of the spectrum, we have major industry disruptions that come to mind when we use that word. Uber's effect on the taxi industry, the iPhone and iTunes on the music industry. On the other end of the spectrum, sometimes innovation, the word innovation, is used just to describe anything that's new, whether it's significantly moving the needle on performance or creating any real value. I prefer to stress that innovation is an improvement to some existing service, product, or idea. Innovation is a less eureka moment and more iterative process. Netflix didn't stop by offering DVD rentals by mail. They redefined the delivery mechanism altogether and pioneered streaming video. They didn't stop there either and moved from content delivery to content creation with original programming that now threatens to upend the entire Hollywood establishment. Uber almost single-handedly defined app-powered, on-demand gig economy while disrupting the taxi service paradigm. But they continue to explore bikes, buses, cars and trucks that drive themselves, and even flying taxis in an attempt to create new value in transportation. Amazon didn't stop by proving the viability of online commerce. They made 2-day free shipping so easy with their Prime infrastructure that now you can get many products by 10 p.m. tonight if you pull out your phone right now and order. Will their joint effort with Berkshire Hathaway and JP Morgan Chase to address healthcare for their more than 1 million combined employees affect the healthcare establishment like their primary service offering has affected brick and mortar retail? Time will tell. What is indisputable, however, is that change is inevitable. While these now iconic logos were redefining industries, there were scores of their dominant competitors that were completely oblivious to the impending doom. If we don't have a good framework for managing innovation, we'll end up watching the evolution of our industry from the sidelines instead of participating in shaping it. I also believe that innovation is inextricably linked to leadership. Leadership requires innovation, and innovation requires the creation of new value that enhances competitive advantage. What your competitors have done or are doing is merely table stakes for playing the digital health game. Leadership is changing the game itself. So this is a framework for changing the game. This digital strategy framework consists of activities that fall into one of 5 major phases: investigation and research, success metrics, analysis, execution, and learn and grow. And of course, the graphic depicts this as a repeating cycle because you know the holy grail for consultants is a project that never ends. In seriousness, though, I detest money pit projects as much as anybody, and you'll see in the execution phase how we can minimize risk and focus resources on the ideas that warrant further exploration while cutting bait on those that are less worthy. All right, as we dig deeper, if you guys have comments or questions, please jump in. We've got time in the session to do that, so it'll be a little bit more interesting than me just lecturing. Investigation and research. Investigation and research is about defining the foundational inputs to the strategic planning process and should not be considered lightly. We want to avoid a garbage in, garbage out scenario. I suggest starting with some inspiration from Simon Sinek's TED Talk titled Start With Why, and his book by the same name. When a software designer or engineer is being tasked with work, the novice project leader will simply tell them what needs to be done and stop there. The pro tells them why a thing needs to be done so that they understand the intent. By knowing the intent behind the request, they are then freed up to develop a solution that best serves it. Many times, what they come up with is much better than what was originally envisioned. As an add-on management hack, pretend you're all children for a bit and you ask that question, why, over and over again. Oftentimes the first answer is not particularly well thought out, and that digging a little deeper reveals the true value. We're going to build a telemedicine app. Why? Because it will serve our population better. Why? Because it improves the quality of care. Why? Because it increases the access to care. Why? Because telemedicine expands the availability of services to underserved, disadvantaged, isolated, and special needs populations. Ooh, that's a good why. When coming up with your why, make sure it's in alignment with the organization's overarching objectives. If the CEO has declared a heavy focus on new patient acquisition, you should be asking how digital is poised to contribute. And I know this is a patient engagement track, but if the CEO has declared a heavy focus on cost reduction, obviously there are digital initiatives that can be brought to bear that a patient never sees, but that dramatically increase the efficiency of how an organization operates. Get feedback from your stakeholders at all levels. Ask them questions like, what opportunities exist for this organization that you think we should be taking advantage of but aren't? What's happening in healthcare that makes you nervous? What are you afraid of regarding our competitiveness? If you were in charge of this organization, what are the 2 things you would change right now to improve overall effectiveness and why? Use your patient advisory groups or set up special focus groups to gather insights on pressing problems from the patient-family perspective and listen to them. And in this phase, inventory the digital and even the non-digital initiatives that are already in flight. In a world of limited resources, there's nothing worse than the proverbial left hand not knowing what the right hand is doing. Depending on the size of your organization, there is perhaps an abundance of brilliant ideas out there that haven't seen the light of day or been given the proper attention. We need to know about them first. Our second phase is success metrics. We have to have a way to determine the impact our strategy is making. This is equally relevant at the overarching strategy level as it is on an individual digital initiative that may or may not warrant additional investment. So some best practices for metrics. Metrics need to measure something that is important, so make sure they're in alignment with those overarching objectives we've been talking about. They need to make sure, or they need to measure something that is directly controllable by humans. We can do something about this if we don't like what the metrics are telling us. This dictates that the metrics are driven by action. Also, good metrics are resistant to gaming. So you need to design metrics that can resist or are difficult for some self-centered or person with an agenda to influence those or manipulate those metrics. Metrics should include both leading and lagging indicators. So measure things that predict an outcome and then also measure the outcome itself. And the reason is that those lagging indicators are things that have already happened, and so they're a lot harder to influence. The leading indicators give us a chance to adapt and change course if they are predicting a future that is undesirable for us. Make it a small list. So in any given list, whether it's broad organization, division, product level, 5 to 7 is a good number of metrics. If you are trying to track or displaying any more than that number, you're probably measuring something that isn't very important, and it takes way too long to tell your story. And beware the vanity metric. So vanity metrics are things like registered users, downloads, just raw page views. They're easily manipulated. They don't really tell the story that's valuable information. They don't tell you things that are really useful, like how about our active users, right? How many of our users are engaged in what we're doing? What was the cost of getting those users engaged in the first place? The real data is in retention and repeat usage. And if you're still wondering whether you are measuring the right things, ask yourself how they line up with the big gun objectives of improving health outcomes, patient experience, cost reduction, and provider satisfaction. Moving into our third phase, analysis, we have two components. The first is SWOT analysis, which has been around a really long time. So if you've seen it before, I apologize for the unoriginality, but I really don't see this being used consistently or to its best effect. This kind of introspection is really, really valuable for an organization. Identifying strengths, weaknesses, opportunities, threats, those are things that also can be done at various levels. Can be performed at the broad organizational level, division or department level, small team level, even at a product level. It takes a group to conduct this analysis. This is a discussion. And so perhaps the greatest benefit of doing it is that it aligns how everybody thinks about their performance in terms of what they're doing well, what they need to improve on, where they should be applying their efforts, and what could derail their pursuit of success. That alignment and understanding of purpose yields benefits in every other element of this strategy framework. The second component in the analysis phase is much more externally focused. So you should be looking at what similar organizations are doing in pretty significant detail. That screenshot is a simple spreadsheet used during a patient and family-facing app project where we cataloged what all the top hospitals were doing in the mobile app space. The analysis revealed what level of EHR integration was being achieved, what the primary feature sets were, whether the apps had seen continued development beyond the initial launch. Don't forget to look outside your industry for inspiration. I've already, in this presentation, used several non-healthcare examples. I know running a hospital and being in a healthcare setting is very different from those areas, but there are absolutely lessons to be learned. There are blockers in the healthcare organization that have prevented a lot of disruptive innovation that aren't going to be there forever. And so learning those lessons now, becoming students of innovation in general, is valuable. Often the most valuable ideas are a synthesis of individual tried and true ideas being brought together in a unique way in a new environment. Using mobile as an example, simply looking at user experience patterns in popular apps can lead to creative application in your own space. LinkedIn's previous feature, they don't have it anymore, but they used to be able to allow linking to other apps in their app family from a common menu across all the apps. That served as an inspiration for us as we were working to figure out how to strategize an ecosystem of healthcare apps, because one of the challenges we have in healthcare is that, especially in disease-specific scenarios, the populations that we're serving are vastly different, have vastly different needs, and it's hard to think about an application that potentially serves all of those populations, but we don't want to duplicate functionality if we're building apps for different patient groups. We don't want to duplicate appointment making. We don't want to duplicate you looking at your health record. So that LinkedIn framework allowed us to create a vision for how you might develop a suite of apps for a healthcare setting that would all play nice with one another, right? And add value rather than distracting from the user experience. Spotify's playlists provided a foundation for a design that delivers and organizes content for financial services providers. Sometimes the crossover from one industry to another is going to be the secret sauce for your next digital health project. As with every component of this strategy, competitive analysis is not a one-and-done exercise. We all know things change really fast now, but we all have a lot of competing priorities for our time. If we're not active in our monitoring of the landscape, we are going to potentially easily miss an opportunity or stay on a path that no longer is leading to success. Now we get into execution. So while everything we've talked about so far is kind of table setting, this is when the meal begins. Remember the inventory of initiatives that I talked about back in the investigation and research phase. Now that we have those lists of initiatives, we need to categorize them into one of these four categories. Question marks are formative stage ideas. We have an idea, but we're not really sure whether it's a good idea or a bad idea. To separate the good ideas from the not yet ideas, we need to form a hypothesis and test that hypothesis by spending the least amount of time and resources necessary to learn something. Many of you will have heard that called a minimum viable product, or MVP. process for building and testing an MVP is thoroughly detailed in the Lean Startup book by Eric Ries. But this is not just for startups. The fundamentals of managing chaos with a repeatable and disciplined process can be applied in the largest and most complex healthcare organizations, and it should. So let's use a simple example to run through the quadrants. Hypothesis. If we send patients a text reminder the day before their appointment, we will reduce the number of no-shows. Now, we can prove that hypothesis with a fairly small technical lift in a relatively short period of time with some representative sample of our target population and using a comparison, before and after comparison of the relevant metrics. Now, if we're right and the text reminders do reduce no-shows, our appointment text reminder has been validated and it's now a star. It has been proven successful. We know that money and resources and time dedicated here will yield dividends. And our task now is a question of increasing the impact of that idea. Let's hold there for a second and go back to the question mark. Now, what if we're wrong and the text reminders don't reduce no-shows? Our idea has failed, and it's a dog. We spent some effort implementing that test, but we're not going to spend any more except what we need to learn from that failure. Why didn't it work? Was it because we chose a bad test group that isn't representative of the target population? Are they not showing up for a reason other than they forgot? Perhaps we're serving a low-income population that has bad access to public transportation. It's not that they're forgetting about their appointment, but actually having a hard time getting there. So even though we failed, we learned something valuable, and now we have an opportunity to pivot. Assuming we've got some compelling data to back up our new hypothesis, we get another chance at the question mark box, right? We get approved for another test. Hypothesis. If we send patients a text reminder the day before their appointment with an offer for a free ride, we'll reduce the number of no-shows. True or false? All right, so back to stars. Our proven successful ideas, poised to contribute to our strategic goals. And now we have a question of scale. How do we magnify positive impact? Now, while the shortcuts that we took to get the MVP out at a minimal expense in a minimal amount of time, that will often dictate necessary additional features or a more robust infrastructure to be able to scale this thing up to a star. It's also possible there's another scenario where the infrastructure is fine, right? And we tested our hypothesis by rolling it out to a small user population, and we can simply continue to roll it out to additional user populations and increase our learning and validation of the idea. All right, so once our rising star is scaled to the point that it serves all of its envisioned user base and no longer requires new feature development to achieve its goal and deliver value, it's a cash cow. So I know, especially in a healthcare setting, maybe not every one of these ideas actually makes any cash, but I like cows, and it's a catchy phrase that embodies well-established performer, right? So imagine our appointment text reminder has been in production for our entire user population for 2 years. It's reduced no-shows by 60%, and it's saving an average of $200 for every hour not missed. Its contribution to meeting our goals is undeniable. Now, notice the innovation arrow that goes back up into the stars quadrant. Even though the pace of development can be slower, and the skill sets of those maintaining, excuse me, and those maintaining a cash cow can be somewhat different from when the initiative was a question mark or a star, we still can't ignore the world changing around us. Phone call reminders used to be the appointment reminder paradigm, right? Until we all stopped answering our phones from anybody that's not in our address book. What happens to our text reminders when texts are no longer the most common use of communication? I don't know what's going to replace texts or how long that's going to take to happen, but continuing to find new ways of delivering value is what puts us on that slow road to obscurity. All right, but sometimes, despite our best efforts to keep a solution fresh and relevant, its useful life comes to an end. Who knows, 20 years from now, internet-connected ocular implants with hologram heads-up displays might be all the rage, right? And text reminders won't serve the majority of users. When that time comes, we just need to gracefully manage the declining use of the solution. Now, it might continue to serve those of us old-timers who refuse to get nanobots injected into our eyes. So it could live on for a while on life support as a dog in the quadrant there before being eventually sunset. All right, let's talk a little bit about where we get our ideas. So although that inventory of existing initiatives is how we first populate these quadrants, what about new ideas in the future? You need to establish a simple and effective input mechanism that allows you to capture what your best and brightest have to offer. Go out and talk to your departments about their ideas. Invite them to information sessions that talk about how their ideas can be made reality. I know CHOP, their Office of Entrepreneurship and Innovation, has in the past held open office hours where staff can come talk about their ideas for innovation. This morning, the CIO panel mentioned innovation challenges, formal contests within an organization. There's plenty of ideas out there for this, but put something or multiple things in place that help you formally capture ideas and feed this machine. All right, let's say we get really good at collecting ideas and there's more question marks than we can possibly effectively test with our given resources. So we need to start prioritizing those items on criteria like, to what degree do we think these predicted results are going to address organizational objectives? To what degree is the organization ready for the change that we're trying to implement? What potential return on investment is possible? And here's a favorite of mine. To what extent is the success of this project subject to a potential road-blocking risk? So, for example, if getting information in and out of the EHR is core and fundamental to the initiative, just stop right there and replace this with another question mark in front of it in line, which proves and demonstrates that that data flow is possible. And I'm not talking about, yeah, there's an API in the catalog for that, and they say it can be done. Prove it. Actually show the data flow, and do that first before any effort is spent on implementing the solution. All right, change management. I'm not going to spend too much time here, but there is often this disconnect in organizations that get hyper-focused on the idea, designing and building the thing. Is the thing going to have this feature or that feature? Do we have enough time and budget to implement this thing or that thing? No one steps back and really considers how we are going to launch this thing. What happens when it's built and the builders go off to build something else? Digital initiatives, especially when being scaled up for a broad impact, do not happen in a vacuum. You have to consider what it will take to make the organization ready for this change. We know that proactive communication that drives inclusion rather than exclusion dramatically increases our chances of success. We know that even in highly automated technology solutions, some existing human process is bound to be affected. We know our training staff and marketing teams have prominent roles to play in the evolution of our digital initiatives at various stages of their life cycle. So let's get them involved early and start having those discussions now while we're designing and building. Keep calm and make change. All right, here we have a human framework to execute our digital initiatives. Now, notice this is not an org chart. Now, I know any of you that are from large enterprise organizations have org charts, and you either love them or you hate them. But regardless, I encourage you to think about how you can most effectively assign team members to roles that put the success of the initiative at the center, whether that's a direct match for your hierarchy or not. I see the need for 3 distinct teams, tied not to departmental structure, but to the initiative itself. Now, governance teams are fairly self-explanatory. They control the money and have ultimate authority and responsibility for the success of an initiative. They enable our project execution teams, which are the architects, engineers, designers, product managers, that design and build whatever needs building. They are informed by and report to project approval teams. Now, approval teams is a really interesting case, especially in a healthcare setting. These approval teams can be created and destroyed for each project. They don't have to be permanent, and in a lot of cases shouldn't be. These are the folks that evaluate the opportunities and make recommendations on approval or rejection. Now, non-IT members of this group are especially necessary in a healthcare setting where clinical expertise is needed to both determine value and create it in most cases. And finally, I need to reiterate that this is a constantly evolving process based on lessons learned, changing priorities, and competitive forces. Your digital health strategy needs to be documented. All of this isn't just thought exercises. It has to result in something that gets shared with the entire world, at least the entire population of your organization. Everybody needs to know what your objectives are. And it's not a one and done thing. You can't just put it on the shelf and say this is our digital strategy. Every year you should be going through this thing line by line and seeing if those assumptions that you made and those plans that you made still ring true. How has our mission changed? What brilliance in our own ranks have we discovered? What strengths do we have now that we didn't have before? What weaknesses have we discovered now that we didn't know before? How has the competitive landscape and the innovation trends in general evolved? Most importantly, what have we learned from what we did last year? How have we performed against our stated goals? What did we do well? What can we improve? So if you've ever done a retrospective exercise, you'll recognize those questions, but the answers don't do any good if they're not turned into action items. So this is the industry that improves lives, saves lives. Technology undeniably has a prominent role to play. As those responsible for bringing technology solutions to life, we should be unwilling to be less than we can be. If the framework I've shown you doesn't resonate, that's fine. Fight to implement one that does resonate with you, but never stop working together, reaching for faster, better, more efficient